So we're going to be talking about stretch optic neuropathy, and this stretch is in quotes, of course. So optic neuropathy, of course, the usual symptoms: decreased visual acuity, decreased visual field of any type, usually nerve fiber layer type or central scotoma, secocentral scotoma, and the nerve might be swollen or it might be pale. So you could have disc edema, optic atrophy, or in the retrobulbar form, the nerve is normal. And the critical sign, especially if the nerve is normal, is the presence of the relative afferent pupillary defect. So stretch optic neuropathy means that the optic nerve is not being compressed. So normally if you have a tumor, like a cavernous malformation, or you have big muscles from thyroid, it smashes on the eye nerve. So these are compressive optic neuropathies. However, there's this other mechanism by which you could get optic neuropathy without any compression, and that is called stretch optic neuropathy. So here's the optic nerve, and normally it's sinusoidal in its shape because you have to have play in this optic nerve to allow you to look to the right and to the left so that your eye nerve can move. So if you had just a straight optic nerve, every time you look to the right, you'd get gaze-evoked amaurosis because you'd lose your vision because it would stretch the optic nerve. And so that's why this optic nerve has this little bit of give and play. The tortuosity of it is to allow the nerve to look to the right and the left. However, if you have proptosis and the nerve is being stretched, that also can cause an RAPD and loss of vision. And sometimes we can see it stretch so much it's pulling on the back of the eyeball, like pulling on a balloon here. So this is like the balloon string, and then you're pulling on the balloon. So this pointy back of the eye is also a sign that it's stretched. And of course we have this big proptosis. So stretch optic neuropathy is literally from stretching the optic nerve. We can see it radiographically pulling on the back of the eye. And even if there's no compressive lesion, there's no mass, it's just pushing forward. And so the common things that we see this in is thyroid eye disease with big muscles, but they're not pressing on the orbital apex, or you have an acute hemorrhage or something retrobulbar that just pushed the whole eye forward. And these cause a special type of optic neuropathy, but not from compression, stretch optic neuropathy.